Welcome to our training, Messaging in a Way That Unites Us. I'm your host, Carly Ornstein, National Director of Lung Cancer Education at the American Lung Association. During this training, we'll discuss some points for you to consider when you engage in lung cancer advocacy activities. These activities might include talking to your congresspeople, doing interviews with the media, speaking at events, or even just talking to people in your network about lung cancer. The way you frame your message can impact lung cancer stigma. Stigma is a complex issue, and the only way we're going to be able to tackle it is if the lung cancer community changes the way it talks about lung cancer. So today, I'll go through some guidelines for you to consider as you share your story so you can be the best advocate you can be, and we can help move the needle on lung cancer stigma. In today's training, we're going to review some stigma-reducing messaging guidelines. We're going to discuss ways to respond to the question, did you smoke? Then I'll review the major points we discussed. And then I'm going to close with some parting thoughts and where you can access more resources, including a copy of this training transcript for future reference. Let's jump right in. So one point you might want to consider when you're thinking about how to tell your story is not placing an overemphasis on your smoking history. For some people, this is not something that you ever think to factor into your story, but for others of you, it's something that you usually include. But the bottom line is that when we separate ourselves by smoking status, it can create divisions in the lung cancer community. And in order for lung cancer to get the attention it deserves, we need to unite as one community. Also, if smoking status is always part of the conversation, it only reinforces to the public that it's acceptable to ask if someone smoked when they hear of a lung cancer diagnosis. So I want to be clear and say that we know that smoking is the #1 risk factor for lung cancer. And when we're talking about lung cancer prevention, it's important to recognize this fact. But once someone's living with lung cancer, we should really think carefully about whether or not a discussion of their smoking history is really relevant to their needs and hopes for the future. Some people do feel like their smoking status needs to be included in their story. And if you feel that way, if you feel like sharing your smoking status is an important part of your story, there are certain words you should avoid that could worsen the division in the lung cancer community. Words like deserve, blame, cause, or bad, they can be very stigmatizing to other lung cancer patients. Unless, of course, you're saying no one deserves lung cancer or no one is to blame. I know that this can be a little confusing, so I'm going to give some examples. So for example, if you want to share that you were a never smoker, you might say, I wasn't at high risk for lung cancer, so I was completely shocked. Instead of saying, I didn't deserve lung cancer, I never smoked a day in my life. Or another way to frame the message would be, I share that I never smoked so people know that lung cancer can affect anyone. Instead of saying, lung cancer isn't only a smoker's disease. Now, if you have a smoking history, you might want to say, when I became addicted to cigarettes at a young age, I never imagined I would end up with lung cancer. That is less stigmatizing than I knew I shouldn't have started such a bad habit, which downplays the incredibly powerful nature of the addiction. Or you might say, I knew I had an increased risk because I smoked, but nothing prepared me for actually hearing those words. Instead of, I know smoking is bad and that it caused my lung cancer, but it was still hard to receive the diagnosis. So you can see that sometimes the distinction between the two phrases is minor, but they have very different impacts. Some elicit empathy and a sense of community, while others allude more to a personal responsibility and can divide lung cancer patients based on experience instead of uniting them. But you might not want to share your health history at all. The risk factors you may or may not have been exposed to may not play a large part in your personal story, or might not be a choice of focus when you share your story, and that's okay. What you include in your story is your own personal choice, but taking a step back and thinking, is there a way I can say this that is more unifying or inclusive, is a really valuable task and will make your message much stronger and less stigmatizing. The other major contributor to the fear and stigma surrounding lung cancer is the low survival rate. Fortunately, incredible advancements have been made in lung cancer in just the past few years, and lung cancer outcomes can improve. Including messages that are hopeful and speak to lung cancer progress help to reduce stigma because it begins to show that lung cancer isn't a death sentence. So as you tell your story, you might want to focus on making sure you include messages of hope and the impact that lung cancer research and advancements have had on you. I want to touch on the topic of uniting the cancer community in general. Unfortunately, cancer is something that has touched most families in some way. And if it's touched your family, it's devastating no matter what kind of cancer it is. Also, we know that innovations in other cancers have helped pave the way for some lung cancer advancements, like in the case of immunotherapy. So it can be tempting to compare the attention lung cancer gets to other cancers like breast or prostate, but that's another message that can be dividing. And it could also offend or isolate someone who might have a personal connection to another type of cancer. So this is just another item for you to consider as you frame your message. Unfortunately, an all too common question lung cancer patients and their loved ones have to field is, did you smoke or did he or she smoke? Patients report this question being the most distressing behavior they encounter when they reveal a diagnosis to someone. So that's why it's so important to address it when it comes up. And there are a few ways to address this question that can help change the conversation about lung cancer. There's no right or wrong way to answer. The approach you choose is based on the situation you're in. You might respond differently to a stranger than you would to a close friend who's asking the question, or you might respond to a journalist differently than someone you've just met. Whether or not you have a smoking history might also impact how you choose to respond as well. And lastly, your comfort level plays a part. Some people are more compassionate or they prefer a more compassionate or educational approach, while others might rather be more confrontational. So the message suggestions I'm about to go through are designed to be guidelines for you to consider. It's always best to phrase responses in your own words and in a way that feels comfortable to you. The most important thing is that you're speaking up. As I mentioned before, there are different ways you might want to approach this question. Your response might be educational, like discussing the multiple risk factors for lung cancer, or educating about the impact of the question. Your response could be challenging, which can make the questioner reconsider why they're even asking, did you smoke in the first place? Or your response can be more empathetic, acknowledging that most people don't intend to be hurtful, but that's how the did you smoke question often comes off. So now I'm going to go through some sample responses. If someone asks, did you smoke? You might want to say, I did, or I didn't, but did you know that never smokers can get lung cancer too? Then you might want to follow it up by saying, in addition to smoking, there are other risk factors like exposure to radon gas, secondhand smoke, asbestos, air pollution, and family history. Then you might want to mention that in many cases, people don't know what caused their lung cancer and that anyone with lungs can get lung cancer. Another way to answer this question that's a little more confrontational is to say, does it matter? When someone says, did you smoke? You say, does it matter? This is a good way to challenge the person asking the question to think about their own biases. You might want to follow it up with, it shouldn't really matter why or how I got lung cancer. I just really need support as I go through treatment. Or no one really knows exactly why I got lung cancer and I prefer not to focus on that. No one deserves lung cancer no matter whether they smoked or not. This type of response can be effective in catching the attention of the questioner, but it could also shut down communication if the person feels attacked. So it's important to consider this point when using this response. It might not be appropriate for every situation. Another way to respond is to appear empathetic to the person asking the question, but use it as an opportunity to educate about the impacts of the question. So you might say, I know where that question comes from, but do you know how hard it is to hear that when you're diagnosed? And then you can follow it up with, I understand why you might ask that. You want to know why I got lung cancer, or you're worried about your own risk. and I know it can be really hard to know what to say. And I know you didn't mean any harm by your question, but it assigns blame to those of us with lung cancer. It assumes people with lung cancer deserve to be sick if they ever smoked, and it doesn't make me feel very supported during this time. Most people have never thought about the impact of asking, "Did you smoke?" Sharing the negative effects of this question can be an eye-opening experience for the questioner, who will hopefully think twice before asking another patient if they smoked. Another direction you can take is to answer the question honestly, but then educate about the powerful addictive nature of tobacco. The bottom line is that many people lack empathy for people with a smoking history, and that's a major driver of lung cancer stigma and one reason why the disease has remained in the shadows. It's difficult for the public to think of smoking as an addiction rather than a habit, but the truth is smoking is incredibly addictive. Most people started young, and we know that tobacco companies have targeted minors. The powerful addictive nature of tobacco is something that can be hard for people who have never smoked to understand. No one should be ever judged for a choice that they made, and most people who smoke or used to smoke wish they never started. So the bottom line is that lung cancer patients deserve empathy and support, and no one deserves lung cancer. Encouraging the public to have empathy for all lung cancer patients will be a step in the right direction for reducing lung cancer stigma and uniting the community, and these types of messages that I just mentioned can be helpful in getting there. I hope we've given you some food for thought and that you'll consider some of these guidelines in your advocacy work. So let's recap what we went over. Let's start with some things to avoid. As I mentioned, an overemphasis on smoking status can divide the community instead of uniting it. Emphasizing smoking history reinforces that it's acceptable for the public to ask lung cancer patients if they smoked. It can also make some patients who smoked feel as though they're being blamed. Focusing on shared experiences of lung cancer patients helps bring the community together, and it empowers other advocates to speak up. We want to avoid words that are stigmatizing and divisive, including deserve, blame, or cause. So think about if what you're saying includes those words or even implies them, unless of course you're saying no one deserves lung cancer, no one is to blame, as I mentioned. Also, avoiding comparisons to other cancers is important. That can isolate people who have experience with other cancers, and in order to move the needle on lung cancer, we all need to join together. We also need to remember that advances in other cancers can help lung cancer, as I mentioned. And lastly, we want to avoid ignoring stigmatizing behavior. It can sometimes be uncomfortable to speak up or challenge someone's ideas or questioning, but it will get easier the more you do it. So now let's talk about what to include. When you frame your story or messages, do include hopeful stories to counteract the fatalism associated with lung cancer. Speak in a way that is empathetic of all people living with lung cancer. Ask yourself if you're isolating other lung cancer patients with your tone or words. Also effective is sharing how lung cancer advancements like screening or drug approvals have affected you personally. It's a great way to grab the attention of congresspeople and journalists and make a strong case for further support of lung cancer research. As I've mentioned before many times, messages that unite the community are powerful. So when you're considering how to craft your message and story, some questions you might want to consider and step back and think about are, well, what challenges are we all facing? How can we all come together to change the way people think and talk about lung cancer? How can we empower more patients and their loved ones to speak up? How can we bring lung cancer out of its shadows together? Sharing your story is a great first step, and I hope that what we've shared today empowers you to do just that. For more information on lung cancer stigma, including our report addressing the stigma of lung cancer, please visit lung.org/stigma. A written transcript of this presentation will also be available on this site so that you can go back and reference everything I've discussed today. Thank you for your time and all you do to raise awareness of lung cancer.